So welcome to the Board of Health meeting on Wednesday, September 15th, 5 to 7 p.m. Pursuant to Chapter 3 of the Acts of 2023 and Act relative to extending COVID-19 measures adopted during the state of emergency, signed into law on March 23rd, 2023, this meeting will be conducted via remote means and in person, as long as members of the public can easily access the proceedings in real time and participate remotely. Until further notice, this meeting will no longer be broadcast live, but may be watched when the show is replayed on YouTube, so it is being recorded. Members of the public wish to participate in the meeting may do so in the following manners. In person at the Roe Park Meeting Room located on the second floor at Plymouth Town Hall, 26 Court Street, Plymouth, Mass. Note the occupancy limit of the room may reduce the number of attendees that can be accommodated. Remotely, you should use the Zoom information that's present on the agenda. You may also send any comments or questions that pertain to a current agenda item to publichealth@plymouth-ma.gov. They'll be read on the air and answered by the Board of Health as practicable. If time doesn't permit answers during the meeting, responses will be sent via email as soon as possible. So our first usual agenda item is approval of the previous meeting's minutes from August 21st, 2024. Do any members of the board have corrections or changes that need to be made? No? No? Make any changes? Lorenzo, any changes?
No changes.
Okay, then would someone please make a motion to approve the minutes as presented from the meeting of August 21st? Dr. Reed makes the motion. Is there a second?
I'll second it.
Amy seconds the motion. I will call the roll for those who were present at that meeting. Dr. Reed, yes or no?
Yes.
Amy, yes or no?
Yes.
Lorenzo, yes or no?
Yes.
Meg, yes or no?
Yes.
Myself, yes. It's unanimous. Minutes are approved unanimously, 5-0. Next item of business is a variance request for a rooster from 31 James Court Circle. Elizabeth, you the present? Would you make the presentation? Please take a seat so we can take a.
Okay, I'm actually new at this. This is Henry, my rooster. The first two pages, third page is my emotional support letter.
Beautiful for training.
He's beautiful.
It's beautiful.
So approximately 1 year ago, Penelope hatched 8 babies. 4 of them were roosters. After a complaint, I found a home for the 4 roosters at a sanctuary in Hadley. A second complaint was made that there was still 1 rooster. Approximately 6 years ago, I purchased 6 pullets from Tractor Supply. One of those pullets was a rooster, Henry. By the time I realized he was a rooster, I was attached. Almost 6 years have passed without any complaints from neighbors. Everyone I asked said Henry doesn't bother them. Many said they like Henry. Approximately 4 months ago, someone complained about the noise. Henry is now indoors. We let him out after 9 a.m. and he is back in the house before dark. Henry warns and protects the hens from predators. Henry keeps the hens from frightening. Henry rounds up the hens when it's time to go in for the evening. Henry crows maybe 3 to 4 times a day. He's an older rooster. He doesn't crow as much. He doesn't have another rooster to compete with. So the 4 roosters I did have, they were allowed. And I don't blame anybody for complaining. But we have 24 houses on this James Circle. Many of these homeowners mow their lawn once a week. We have 18 dogs on James Circle. Some of these dogs stop barking as early as 5 a.m. We have crows, geese, ducks, and hawks, which make plenty of noise throughout the day. There is yard work and home repairs being done throughout the year. We live near a pond. There is jet skis, boats, and four-wheelers and fireworks. Last year, one of the neighbors spent the entire summer cutting down trees on his vacant lawn. These are not complaints. I'm certainly not bothered by these, but Henry makes minimal noises compared to everything I just listed.
So you're asking for variance from our regulations?
Yes, I'm asking to keep Henry at 31 James Circle.
Okay.
He's not let out until after 9. And he's in before dark.
Could you inform us about the precise wording of the regulations?
Yeah, no roosters are prohibited in the town of Plymouth.
All roosters are prohibited,
All prohibited.
short and sweet.
Yeah.
I have a question.
Mhm.
It says, in this letter that it's a emotional support animal.
Mhm.
So does that,
Well, that's what you'll be talking about tonight.
and.
So in your packet,
Called an emotional support animal.
He's an
Position.
to me, he's my emotional support animal.
I don't know how you go about getting an animal, labeled a support animal.
right, so in the packet that was given to you, there's a letter from Atrius Health, but it's actually blank. I don't know how that happened. Oh, my
Oh.
blank.
Ours
That happened.
ours is one sentence long, and it's from
Okay.
Yep,
Okay,
it's
sorry.
what you had put in the packs.
So,
Yeah.
Deborah Foreman, who is apparently a nurse practitioner.
yes, and she's covering for my doctor, she's on maternity leave.
Mhm.
So this is what you have, the board has to consider. The town of Plymouth does not allow roosters, however. We have a person here who has medical documentation that she is utilizing one rooster as a support and emotional support animal for herself. We'll read into the record, have been people who have sent emails who couldn't make it tonight, that asked that their thoughts be added into the record, so. Also, to let you know, as you can see in the packet, all the butters were notified. Are there any butters here? No. Okay.
Yeah,
Are there any online?
Carolyn,
There is a Zoom user.
one of the, engineers. Carol and Bill said they were coming today. I did get a letter from one of my neighbors. I had many neighbors, offer to sign something that they don't mind the rooster. But I didn't wanna put any other neighbors on the spot, and I didn't wanna pit neighbors against neighbors. And I didn't wanna, I mean, if I go around with a letter or petition, what if somebody doesn't wanna get involved? I don't wanna.
Okay, so this is actually, we received in the office, and it says, to whom may concern, to the board. During the last year, I spent quite a bit of time working in the garage at my summer place at 22 James Circle. During that time, I found that the neighbor's rooster created much more than minimal noise. The noise was irritating and continuous. The house directly across the street, number 26, is in the process of being sold, and I believe the noise would be very unfair to the new owners, particularly if they are year-round residents. From 9 AM to dusk can be a very long time listening to the rooster's noise, particularly since the area is otherwise very quiet. It is in fact an indoor rooster. Oh, I'm sorry, if it is in fact an indoor rooster, can outdoor time be substantially reduced? I often wondered if the owners were actually at home during the day, surely the noise would also bother them. I am unable to attend the meeting on September 18th, but I would like my opinion on record. And that is, he puts in quotes, the noise is very unfair to the neighborhood, unquote. So there are also, as you see in the packet, many other abutters that Elizabeth, sent her letter to. So, I would have to say that we've definitely covered your bases with reaching out to your neighbors to let them know that this particular hearing was being held. I will also remind the board, there's precedent set on this. You have had a rooster come before you in the past, with also, evidence of it being an emotional support animal. I will remind the board that you voted against, not you, the board.
Yes.
Wasn't even you.
Yep.
It was the board. The board voted against that, upheld the regulation to have the rooster be prohibited. And we, the town received correspondence from, the American Disability Association telling us that we can't do that. So, in light of that, an additional hearing was held and the board's original determination was overturned. And the rooster was granted the ability to become and stay a support animal for that particular resident. Just to remind the board that there is a precedent that has happened. in the
Thank you.
past.
But there were
These-
conditions attached.
Two of my, yeah.
There were, and again, the board can certainly consider making certain limitations to granting the approval of keeping the rooster. One, the department would recommend is a crow collar when the rooster's outside.
What's that?
It's a little collar you put around his neck and he can't crow.
Like it restricts
He
it.
cannot make the actual motion that he has to make in order to crow loudly.
So it's a physical restraint around the neck, but it doesn't deliver any kind of painful shock. or-
Correct, and we did the same thing for the other rooster.
I recall I was present, I think it was my first year on the board. Any other questions?
I think another neighbor, a butter, has joined us. I don't know if you want to say, okay,
Would you just come forward so we can put you onto the screen, please?
Oh, yes, thank you. Is it, yeah,
It's in the, yeah, it's what,
My name is William Stone. I live at 30 James, which is directly across the street from where Henry lives. And I have a lot of respect for Liz and Jerry for the way that they care for their hens and for Henry. If I'm not mistaken, a number of roosters were taken to a farm that accepts roosters. Approximately 6, so that the owners of Henry have been in compliance with the spirit and the letter of the town ordinance. The difficulty with Henry was he was relocated to a farm with other roosters, but he was attacked by other roosters. I saw Henry when he came back from, if you will, the abuse he received from other roosters at his farm. He looked like Rocky in the movie when he came back. I was shocked because I'm not familiar with hens and roosters. I had no idea that there was some sort of pecking order in the rooster world. And I have enjoyed smiling every time Henry makes his noises. I asked Liz if there's such a thing as a rooster having a lisp, because his noise, whenever he does it, makes me smile. And I literally miss him crowing at 6 a.m. And I have asked Liz to not put the anti throwing cockadoodle, device on Henry. Because I feel his pain. I don't know, that it doesn't hurt him, sir. It seems to me, from listening, I cringe, when he, makes his noises and he's got the call. None of my business, but I did say to Liz, please, don't put that. Because, I like his noise. His noises remind me every day, that I'm alive for another day. So whether he makes his noises, and it bothers somebody, it makes me smile. Because, I know Henry's out there. I've seen what I call the happy hands, which Liz takes care of. And if I go to a nursing home or assisted living, or any of that type of place, I would like to receive the care that Liz and Jerry give to the happy hens and to Henry, because they're fastidious on everything they do. They have, they are excellent neighbors, including the happy hens and including Henry. I've lived at the James Circle for 35 years. And the only thing that's ever made me smile when it happens, it's Henry making his noise. And, selfishly, I, hope, the board, by the way, thank you so much for serving. What you're doing is, such a benefit to the town. I hope the board can understand that, this is, a pretty, beat up rooster, not by the owners, but by the pecking order, which I now have learned exists within, the farms that these roosters are taken to, hopefully not bother the neighbors. So, all I want to say, without repeating myself, is, thank you for serving. Hope you find it within your authority to make as much allowance as you possibly can. I, and my wife were elected, president and treasurer of the James Circle Homeowners Association, decades ago. I have not heard any of the neighbors complain about him. That's why I came, because I talked to, Buddy Point, who is the immediate next door neighbor, if you will, a more senior resident in amount of years living on James Circle. Doesn't bother him, doesn't bother me. I don't go around knocking on doors and saying, there's something bothering me. That's a way to waste a lot of time. But there's been no spontaneous uprising, that I'm aware. And I came tonight because I want to express again my thanks to you for serving. And hopefully Henry, will, have a peaceful existence he's done nothing wrong. And that's all I can say without, repeating myself. I'm happy to answer any questions. And yes, Carol and I did work with the town of Plymouth to have James Circle, accepted as we were a private way, to organizing. We raised funds, as 24 homeowners to, prime the pump with the town of Plymouth. In other words, we put up money, to help town of Plymouth, accept the road, pave it. There used to be flooding in 15% of the homes in the basement. So that's kind
Sorry
of,
to interrupt, but this is not, this is, you're kind of departing from the. from the question.
Action figure, Henry,
yeah,
if you don't mind.
I'll, go ahead.
So
So,
when, approximately 3 years ago, I gave Henry to a farm, and I checked on him 3 weeks later. This is what he was talking about. And so the dogs kind of attacked him, Henry. It was a good farm and everything. It's just that Henry was domesticated and he living on a farm for him.
There's,
And I'm okay with the profile, absolutely.
there's another letter too that, they asked we put in the record to a
Please
different
read.
person. We want you to know that we enjoy, this is read the rooster. We want you to know that we enjoy hearing him crow. It reminds us that we are in the country. After all, this is why we moved to this area. We think that it's a sad situation when someone complains about a rooster crowing when there are more things around that make more disturbing noises. Yes. Although lawnmowers are necessary evils, they are also louder than Henry. We hope that you and we are not deprived of hearing your pet. Sincerely, Don and Jerry Williams, 42 Cartersbridge Road.
Are there any other butters? that Sent in letters or?
No, that's everything that we had. I think that's everyone who's present.
So there's obviously,
Thanks, Steph.
there's obviously two neighbors that feel that, you know, Henry should be allowed and should be able to vote. The times when he feels he should. And there's one that seems to object. So based upon this, I'm gonna ask the board members if they have any questions for you or any of the other people, to state them so we can clarify everything and try to make a decision about what we have to do.
Absolutely.
Okay, so Amy, anything?
I don't have any questions, but I want to say to Karen, it was very helpful to understand what had happened in the past, that the medical is valid and necessary, and there's the rooster crow thing that was very.
Right,
helpful to know.
for a service animal, there are only two animals that are accepted, and that's a dog and a miniature horse, but for a
Yep.
support animal.
Yep.
There is a wide range, and
Yes.
it is on a case by case basis, so
Yep.
medical documentation is in the.
Yeah, and it seems like with what the previous board had voted on, it was like there can be a variance for emotional support animals. And there's a way to get Henry to stop making noise outside.
Right.
Okay, thank you very much for that information.
Okay, Dr. Reed, anything? Okay,
Lorenzo, this is Linda.
Lorenzo?
Yeah, I had a question regarding the neighborhood. It's in a homeowners association, right?
Yes, there is one, yeah.
Yes.
Been in the active one, but yeah.
Mhm.
the only reason the homeowner association was formed was to have the road
Maybe.
accepted by the town and to raise funds amongst the homeowners and the town to have paved in order to stop.
And
Right.
I'm sorry, I'm gonna assume that there's no homeowner association covenants or bylaws within the homeowners association that speaks to
You are correct.
animals or roosters or anything like that.
Did you-
are correct.
Did you get a response, Lorenzo? You said you're correct, yeah.
Yes, thank you. And then a follow-up question. So there's zoning bylaws and I don't, I didn't really look into that for Plymouth, but is this
There are
compliant
no
with that?
zoning, no, there are no zoning bylaws that would apply to a farm animal. We are a right to farm community.
Great. Thank you for that clarification. And then, yeah, I think that's it. Those were the two key pieces for myself. If, through the chair, when we get into discussion, I'd like to just speak to the board when we get to that point.
Okay,
No more questions for any of the presenters.
make sure that there's discussion allowed after a motion has been made and seconded.
Okay.
Meg, anything?
Yeah, so I just wanted to call out the first letter that you read. It sounded like he's a summer, like he's only here for the summer and not year round. I don't know. That was,
It did sound like
it
that.
sounded that way.
Yeah,
And then I just have a question, and I hope this isn't taken the wrong way, but I'm just curious, what is the lifespan of a rooster?
5 to 8 years.
Okay.
So he's old.
yeah, he's on the other side.
I'm sorry, how old is he now?
He's 6.
Oh, okay. Thank you.
Oh, summer place.
Yeah.
So now we have, the complainant, is apparently only there during the summers, as Max stated.
Yeah.
And that is the only complaint we have against the rooster. The rest is supported.
Here today, that is correct. Yeah.
Okay. So I think the options for the board at this point is, you can make a motion to enforce our regulations. You can make a motion to grant a variance with conditions. And the conditions could involve times during the day when the rooster is allowed to be outside, could involve a crow collar, could also probably involve, if I remember correctly from the last case years ago, some kind of soundproof pen or structure that would decrease the amount of crowing noise that could be heard, even though Henry was crowing. I know that wouldn't make some people happy, but I think those are the only possibilities that I can think of, short of having to keep Henry inside all the time, which I don't think anybody wants to do, but that could also be a condition.
I'd like to make a motion to allow a variance for Henry to be allowed outside from 9 AM to dusk with the crow collar on.
Okay. Is there a second to that motion?
I'll second that.
Dr. Reed second the motion. So now we can have further discussion. Lorenzo, you indicated you wanted to say something further.
Yeah, I just feel that having Henry out during the times, and first of all, I want to thank you, Liz, for coming up and doing the presentation, but I just feel that, I'm supportive of a variance allowing Henry to be kept, as well as without any restrictions on the crow collar, as long as there's restrictions in time that he's allowed to be outside. That's the motion I would support. Secondly, I would imagine that this variance is not in perpetuity, but really only for Henry.
That's
Right.
correct.
Mhm.
Okay,
Yeah.
thank you for clarifying that. So I would support a motion for a variance to have the rooster with the conditions of some sort of time that he can be outside
Without a protocol.
without a crow collar.
Okay,
Okay.
so the way we have to handle this then is, if someone else needs to discuss this before we take a vote, they should say so we can have the discussion. If not, then we'll take a vote. If the vote passes, that's the end of actions. If the motion doesn't pass, then Lorenzo, I would ask you to make the other motion that you just stated.
Could Lorenzo, what are you thinking on time? Like Henry's outside for a couple hours or?
You know, it gets dark or later, some sort of like 8-hour duration, but, I don't want to, if we have to be very prescriptive of it, I would say 9 to 5.
I think the trouble with that, Lorenzo, is dust changes a lot.
I know.
Much to our utter dismay.
Yeah.
Come another couple of months, it's probably gonna be dark at 4:30 in the afternoon,
Yeah, so then he would go in at 4 o'clock.
which is why you take him in at dusk, regardless of the time of year. So,
Yeah.
So maybe you do an hour after dawn and an hour before dusk.
I'm just
Yeah.
thinking that the dawn is an hour before dawn is 5
No,
or
an hour
after
after
dawn
dawn.
is 5 in the morning in the summer.
Yeah. it's not-
Yeah, I think time is hard. I think time's hard because people aren't always on a certain schedule. I mean, we can definitely take a vote. I feel strongly based on the precedent that was set by the previous board with the crow collar. And then trying to move forward with setting, if we set time limits for Henry because he's old. What about somebody that comes along and has an emotional support rooster and they're young and they're crowing all the time and they're, that's the kind of stuff that I'm just afraid of setting.
Right, well, then the 9 o'clock actually was even, Elizabeth.
Yeah,
within the house.
so and I totally, like,
So
I
it kind of like went
definitely-
along with what's already happening.
Yeah, I see the care that they're putting into
Yeah.
taking care of the rooster and attempting to make neighbors happy and having dogs that bark. I understand what you do that, but having known that there's a precedent set, that there's a crow collar for roosters, I think that's a way, I think that's a good solution to a tough situation.
and I think that another solution would be to, keep it at 9 o'clock in the morning for the earliest time when Henry could go outside. But also say that something like, well, Henry must also come inside 1 hour prior to dusk.
Mm.
Yeah,
Yeah,
I mean, that's pretty much what we do now.
Yeah.
Yeah.
yeah,
Perfect.
So if the board pleases, there is a motion has been made and seconded unless someone, as in Amy, wishes to withdraw the motion, you can. And we're gonna have to take a vote on that motion. If the motion fails, then we'll consider the other option.
sounds good.
Okay? So the motion is to utilize a crow collar and to allow Henry to be outside from 9 in the morning until dusk. Correct?
Yes.
So, Dr. Reed, yes or no?
No.
Okay, Amy, yes or no?
Yes.
Lorenzo, yes or no?
No.
Meg, yes or no?
Yes.
It looks like it's
You
2
get
and
to
2,
tell.
so I get to decide this, I don't like doing that, you know?
Every
Um,
vote counts the same, if that helps you. You could have
Well-
whatever you feel like.
I will vote no,
So that
so the
motion
motion
fails.
fails.
Mhm.
Lorenzo, would you state your motion, please?
Yeah, I'd like to make a motion to allow the variance to have a rooster, Henry, with no crow collar and a time frame between 9 and an hour before dusk, that he can be outside.
And is there a second to that motion?
I'll second that.
Dr. Reed makes the second. Is there any further discussion about it? Hearing none. Dr. Reed, yes or no?
Yes.
Amy, yes or no?
No,
Lorenzo, yes or no?
Yes.
Meg, yes or no?
Yes.
Myself, yes. So I believe that makes 4 in favor, 1 opposed. I would ask you, however, since we're gonna grant this to you with virtually no change to what you're currently doing. If we receive continuing complaints, we may have to revisit this.
Okay, thank you so much. Thank you. Thank you, Lorenzo.
Good luck.
Thank you so much. Thank you.
And good luck to him.
Thank you.
And he's on.
He is. Next item of business for us is going to be a septic variance request for 18 Fresh Pond Avenue. Joseph, are you with us?
I thought I said my
Yeah.
name.
Expected the voice to
Should I sit here? Or?
Yes, please.
Up on the screen.
Oh, good. Yeah. I printed it.
The owl likes to see you, that's why you have to sit there.
Yeah, good.
So if you can just state your name for the record and what you're.
Yep, I'm Joseph Keough. I'm the design engineer for this project, and I'm representing my clients, the Joyces, who just recently purchased the property. Right now, it's a one-bedroom home with a cesspool. So what I'm proposing, I think it's gonna be better. It's gonna have less of an environmental impact, and it's gonna greatly enhance this site in general. It's gonna have a nearly fully compliant Title V system.
Okay,
What do you want me to highlight there?
Yeah, what are the?
is there any more, or should we ask the questions?
Well, the reason I'm here is because I'm applying for a couple of the local upgrade approvals, the reduction in the setback to the property line, which I've had the property surveyed and staked out by Grady Consulting. And then that disappeared.
Sorry,
That's all right.
I'm having.
And then what were the other ones?
They're up
Oh,
there.
well, reduction in the setback to the property line.
Septic tank to slab,
Yeah,
slab foundation. And reduction to allow for. Remove and replace, 2 foot instead of the required 5.
Yeah.
Okay.
Yeah.
Oh, okay.
Yeah, so the only one really the board has to consider, 2, 3, and 4 could have been done as what I consider desk level, which is me, is the property line. So that's the one that the board would have to vote on.
It's 10 feet. Just.
Then the question becomes, is there any possibility of changing that so that you don't need that variance?
well, the main reason why. In the variance, is because you see the tank where it's like right under the cursor there, that's actually a plastic tank. And the lot is actually so small and tight that I actually can't get like a large truck with like a precast frame and a precast tank in. So that's the main reason for the variance, and I'm kind of splitting the difference between, I mean, I might be able to slide it a little bit closer to the garage, but I mean, I'm still gonna, it's tight, so. I did notify the abutters and with like certified mailing and everything, and that they were allowed to come if they had any objections and.
Are there any
Apparently
others
not.
present online? Nobody's wanted to say anything, I guess.
No, well, they're from New Hampshire, too. They live in New Hampshire. So I sent the mailing up to them and.
And we're town water here, correct? Not.
Yeah.
well, Yep.
Yeah.
That's always a good thing too.
Yeah.
And the existing system is accessible.
Yeah, yeah.
Yeah.
Makes a big difference to most of us.
Yes.
Yeah. Are there any questions? No? Questions? No?
Nope.
Meg?
No.
Lorenzo?
No questions.
I have no questions either. So in that case, someone needs to make a motion, to grant the variances.
I'll make a motion to grant the variances as listed.
Is there a second?
That's okay.
Dr. Reed, second the motion. Is there any further discussion? Hearing none. Dr. Reed, yes or no?
Yes.
Amy, yes or no?
Yes.
Lorenzo, yes or no?
Yes,
Meg, yes or no?
Yes.
Myself, yes. It's unanimous. It's your variance has been approved.
Thank you. Appreciate it.
Thank you.
Have a good night.
As soon as I hear cesspool.
Yeah, that's fine.
That's it.
No, burner.
Do you guys do automatic failure for cesspools? Yeah.
And Chris is up next.
Okay, and Chris is,
That is 750 tanks, are
Oh.
automatic too.
Oh, huh.
Yeah.
I don't know if I've even seen a 750 tank, but that's a good one too.
so Chris, are you with us?
Yep.
Yep, here on Zoom.
Okay.
Do you want me to share or are you going to?
I can share if you guys can see it, okay?
Yeah.
Is that up on the screen for you guys?
Yes, yep.
Great. So my name is Chris Sanderson. I'm with Merrill Engineers and Land Surveyors, and I am representing the applicants for this project at 85 Seaview Drive, Connor Higgins and Anna Christie. So 85 Seaview Drive contains an existing single-family dwelling with 4 bedrooms. There's an existing septic system located on the property consisting of a 1,500-gallon septic tank under this seashell driveway here. That is an H20 tank, so rated for vehicle loads under the driveway there. And then the existing leaching field is under the small front yard section in front of the house in between the street. So we have many constraints with this site. It's an extremely tight lot, just over 6,000 square feet. We're also dealing with some conservation jurisdictional areas. We have a top of coastal bank located at the rear of the property that goes down to Cape Cod Bay. And then just not a lot of room. So essentially what we are proposing is to completely remove the existing leaching field that's in the front yard and essentially replace it in kind with a new leaching field. Due to the tightness of the lot, we did have to request multiple local upgrade approvals, which are listed in this table here. The first one being the soil absorption system to the foundation, in which the requirement is typically 20 feet. We're proposing 6.3 feet. Now there is an existing impervious barrier that's installed along the foundation. That was part of the previous system installation. So we have a note on there that the contractor shall inspect that impervious barrier, confirm it's there, and replace it if need be. So that will protect that setback reduction to the foundation. The next one we're requesting is setback reduction in the SAS to property line. As you can see, just not a lot of room to fit this 4-bedroom system. We kind of just centrally located it in between the property lines, the existing tank, which is to remain, and the foundation. So we have a 4-foot setback over here and a 4-foot setback in front. I will mention that there's a retaining wall that exists along the property line. So the grade in the front yard is actually a few feet lower than the abutting property and the roadway. So it's kind of set well and down into the lot. The third local upgrade approval we're looking for is SAS to the water service. Now the water service is located on the left side of the property over here. Again, as part of the previous system's installation, that was called out to be sleeved as part of the installation. So again, similar to the impervious barrier, we're requesting that the contractor confirm that that water line is in fact sleeved, and that if it is not, then to do so to mitigate against that reduction in setback. Next, we have depth of cover over the soil absorption system. So typically we want to see only 3 feet of cover. You are allowed to go deeper as long as the system, again, is H20 rated for the heavier soil load bearing. So I believe we're about 4 feet of cover over that system. And that is really just to make the existing grades work with where the existing septic tank is. We basically had to match the invert elevations of that existing leaching field with the new leaching field to get everything to work. And the final one is a request for doing 1 deep hole in perk in the location. In this instance, that leaching field takes up the whole front yard. We were unable to go do another perk. We do have the existing information here that did show, good sandy material, perked less than 2 minutes per inch. In a situation like this, when the contractor does the remove and replace, we will go analyze that to make sure the design criteria is the same as we're using. So really, I think we designed this for maximum feasible compliance. Not much else we can do in this situation, unfortunately. But yeah, happy to answer any questions from the board.
Okay, thank you.
Yep.
Are there any abutters present or online? And do the board members have any questions?
I have a quick question. So it's next to the system's 4 feet away, and then where's the next door neighbor system? Nowhere near there, or?
I don't know. Chris, do you know how close their system is to your property?
I believe, which side, you look at this side?
Yeah, that's I.
Ideally, it would be 10 feet off of their property line.
Right.
I do probably have that record plan, just not handy.
Cause I don't think they can be 10 feet within each other, right? Like, so if they would grant it, so just to double check that, to
Yeah.
make sure that they didn't need.
And another thing we could do is we could extend this impervious barrier along the abutting edge to kind of protect that lot line. I'd be happy to make
Yeah.
that update.
Yeah,
But I can definitely clarify that with staff, and, I think a easy fix to that would be possibly to sneak that over a little more, even though there's no room. But we could definitely extend that impervious barrier to, create the separation between the two.
mhm.
Okay,
Yep, thank you.
Dr. Reed?
Now, this is replacing a cesspool,
No,
No,
just replacing another.
Mhm.
right, they're keeping the tank that's already there, they're replacing the leaching field.
okay, make
Yeah,
your.
my guess is the existing system, it's actually not that old. It probably just wasn't well maintained. So unfortunately, the new owners who recently purchased the property, as part of that, they have to replace the leaching field.
Yeah, Lorenzo?
Yeah, I was gonna, along those lines, they had to replace the leaching field. How was that determined? Who saw that? Was that something the department?
That would have been a Title V inspection as part of the purchase and sale.
When it failed? Okay.
Yep.
Um, and I just had a question on the Form 9A that you submitted. On page 3, there was, it says there's a section just before section C. If the proposed upgrade involves a reduction in the required separation. I didn't see that variance asked, but I see some Darren Michaels and some date of evaluation inputted in there in 2011. Is that, I don't know, for lack of a better term, a typo, or there is no reduction in the required separation, is there?
The reduction in separation we're asking for, the leaching field to the foundation, leaching field to property line, and leaching field to water service. I think what you're referring to is the perk test that was done by Darren Michaels in April of 2011, which was part of the original repair that was to replace a cesspool on the property. And that's for the soils, and we're not requesting any reduction in groundwater separation. We meet that.
Okay, all right, that's what I thought. It just in the, if you
Yeah,
scroll
I
down
think
in
that
the
would be if we
packet,
were asking for reduced groundwater separation, which we're not in this case.
you're not. Okay, thank you for clarifying that, Chris. No further questions.
Does anyone else have further questions? I think, Amy, you made a good point. So I think this has to be conditional approval. And could you make a motion to that extent?
So I make a motion to approve the variances, approve the variances so long as the distance from their new system is either 10 feet away from the next door neighbor's system, or the engineer works with the health department to come up with a solution to allow for maximum compliance.
Which would be, I guess, an extension of the impermeable barrier.
Yeah, if that's, kind of like if that's what Karen and the engineer decide is sufficient, I would say that would be sufficient.
Okay, is there a second? Dr. Reed seconds the motion. Is there any further questions or discussion? Hearing none. Dr. Reed, yes or no to approve the
Yes.
variance with condition? Okay, Amy?
Yes.
Lorenzo?
Yes.
Okay,
Yes.
myself, yes, unanimous. So, we're granting the variance request. with the conditions as stated.
Thank you very much. And Karen and Margaret, I will find that information tomorrow and get it over to you.
Thank you.
Thanks, Chris.
Thank you.
Next item of business on the agenda is a tobacco sales violation appeal by Richard's Wine and Spirits. You come up, please.
Yeah.
So this is Stephen Berg. He is the owner of Richard's Wine and Spirits. On August 12th, there was their third violation within a 36-month period. It was a $5,000 fine, which Mr. Berg has already paid, but has requested a hearing in regard to the 30-day suspension.
Okay, thank you very much. So would you like to state the reasoning behind your request?
I mean, I have a few things I've written down. I mean, I'm not gonna be as fluid as the other three people behind me, but I'll try the best I can. I was told not to board too many people. Obviously, as Karen said, I'm Stephen Berg. I'm the owner of Richard's Wine and Spirits. Been there for 26 years. Here for a sale of a tobacco product to a person that ended up only being 20 years old. Went to Karen, paid the fine, as she already stated. When I looked at the citation, the date, I mean, it was on a Monday, around 11-ish, I think. Unfortunately for myself, I mean, I'm not trying to make excuses, but I'm there by myself during the day. Deliveries going back and forth to the front, other salesmen come in. I obviously got distracted. Since then, I've changed all my input. Well, the second employee comes in at 10 o'clock in the morning now. Another set of eyes, me or another person up front dealing with the customers. The other person able to do what he has to do down back without having to multitask or whatever. In addition, I asked Karen about information of where I might get an ID scanner. She gave me a name from someone down the Cape. I forget what the association was, of public health or tobacco, but I was, excuse me, I was having no luck with them. So I contacted the Mass Package Stores Association, of which I'm a member. I left a gentleman a message. He got back to me the following day. And I mean, I guess I kind of lucked out. He's the person that's in charge of their scanner department, you know, if they have seminars, this and that. He kind of recommended a couple of them might work for me. One being, I think it was Fraud Fighter, the other was IntelliCheck. He said one was a little bit more expensive than the other, being the IntelliCheck, but that's the one that he uses at his seminars. That's the one that I, you know, since purchased. It's on the counter. I thought, I'm kind of old school, don't own a computer, don't own a laptop, and I mean, the technology always kind of tends to scare me. You put the ID in there, 2 seconds later, there's a word go in green, if it's good. If it says stop, surrounded in red, you know, it's either fraudulent, out of state, or expired. That's about all I have. I mean, I think I've done a couple more things to kind of support my not having to be in front of you guys another time, and hopefully, I think it's a 30-day suspension. I'm just looking for a little leniency if you guys have it in your hearts to do so. I apologize. When I got that letter, it said certified public health. I kind of knew what it was. I mean, it shook me to my core. I immediately went down to the back of the store. That's when I called Karen on that Friday afternoon, and she got back to me on the Monday. It's been on my mind ever since. And here we are. Thank you for hearing it.
So I think what's troubling is that this is the third violation in 36 months.
Totally aware of that.
I don't know if there were similar circumstances the first 2 times or what happened, because we
It
don't
was
know the
myself,
details.
it was myself both times. I mean, I'm 67. I try to do too much myself. My daughter's always telling me, you know, work smarter, not harder. People weren't coming in until 12 or 1 o'clock. I mean, I think I kind of fixed that end of the situation. They're coming in at 10. Nothing really happens at that time. The scanner should help me. I mean, it will help me. It does help us. I mean, been a few instances. I mean, prior to it, you know, you think maybe there's a lot going on, but I mean, it hasn't had to be used all that much. The second set of eyes should help also. But that's about all I have to offer.
Okay. Do any board members have questions?
With the past two violations you, um, did you have to not sell liquor for a while? Cigarettes.
Yes,
It was
yes,
10 days last.
it was 10 days.
10 days.
Yes.
And the first time it was.
It's a.
The first time's a lot.
Yeah.
I mean, that was a lot.
Yeah,
Any questions, Amy? Okay,
No.
Lorenzo, do you have questions?
No questions.
Yeah, I think this is pretty clear. So I've already asked the question, is concerned that how long ago was the previous violation?
The one with the warning or the one with the 10-day
This-
suspension?
The one with the 10-day suspension.
February 19th, 2024,
So within a year, well, within 6 months.
6 months.
Yeah, wow.
And that also troubles me some, because it's been so recent.
And when was the one before that, Karen?
October of 22. So 2023 was a good year.
Yeah.
Thank you. So the end of 24 is gonna be a good year also, and hopefully 225.
Okay, so there is a history. I'm sure you know that there are new rules and regulations for underage tobacco sales now. That's because the fines that are mandated by the state, we cannot change. In terms of suspensions, there are some rules about suspensions that are promulgated by the state, but we do have more leeway. with those. So I believe our 30-day suspension for the third violation is probably in excess of the state's guidelines? Or is that the same as the state's guidelines?
I don't know.
I'm not sure either,
Google search.
Yeah,
but in any event, so the options are, and we've been through this before. The previous one that I remember was very painful because it was a fourth violation. We had to have a formal hearing and the permit was actually withdrawn. So they lost their permit to sell. That was something that, we didn't want to do, obviously, but we have to do that because 4 violations in 3 years is just indicates there's a certain problem involving ability or desire to actually abide by the rules and regulations for underage sales.
It's not a desire on my part,
I know,
I can assure you that.
in your case, it's not, but.
It's eating at me every day since.
Okay. So the only options that I can think of at the moment are, number one is you can vote to uphold the 30-day suspension. Make a motion to do so, if you wish to. And then we have to vote and see if that's approved or not. We could modify the 30-day suspension.
Am I the one that's gonna?
No, you're just gonna listen as we try to figure out what to do. Another option would be to put a suspension of sale in place, but modify the 30-day period. Which obviously would have to be certainly considerably more than the 10-day previous one, but could possibly be less than the 30-day, which is in our current regulations. Have you suspended the sales already in
No,
sort of anticipation of this?
no, I advise them not to.
Okay,
Yeah, anyone who requests to come before the board, I advise them not to do anything till the
okay. So at this point, I need any board member can make a motion either to uphold the 30-day suspension or to modify it to something between 10 and 30 days.
I'll make a motion to uphold this with 30-day suspension.
Okay, is there a second to Amy's motion?
I'll second it, but I also have a question.
Okay, well,
Yeah.
after we finish,
Yeah.
the second, it's been made and seconded, so now we can have additional discussion.
Yeah.
So please go.
What did you find out?
It doesn't say anything about a suspension. Yeah. It says a person who violates this section shall be punished by a fine of 1,000 for the first offense, 2,000 second offense, and 5,000 for third or subsequent offense. So it doesn't say anything in the state laws about suspensions.
So the suspensions are.
Because ours,
Yeah. Yeah, I thought that there was
I
something,
thought
but
there was too. I thought it said somewhere a
It-
minimum of a certain number of days.
you know,
It wasn't for the first violation, I
No.
know.
Are you looking at just section 6, Amy, sale of
Yeah,
possession?
yeah.
I am too, yeah.
I wonder if, you know, what I'm wondering about is the MAHB, template.
Yeah, I'm
Oh.
looking at the model ones. for-
Yeah, thank you. That's, I couldn't remember that.
Unfortunately, I can't see. Oh,
Do you need my cheaters or?
no.
It happens to all of us. It's not that bad.
Yeah, the model one says 30. But again. this
I know, is
the
it
local.
model or is it,
Yeah, this is.
there was something with,
I'm trying to find that one. Remember the one that we were looking at that was all like yellow and green?
so it says, that. So, yeah, I have that one. First violation, 1 to 7 days. Mandatory for first underage sale, second violation up to 7 days, third or more violations up to 30 days.
But it
So
says
that's what
up
the-
to.
Yeah.
Yeah, but, and we as the board decided 30 days.
Okay.
Is that what you're remembering, Margaret?
That's what I'm coming up with. Yeah. 'cause
Yeah.
I'm looking for.
And I think second violations were changed to 14 days,
14 days.
if I remember correctly.
That was us that
We
decided
did
that.
that.
Yep.
So we have a motion to uphold, the regulation and enforce a 30-day suspension of sales, which has been seconded. So what we have to do is take a vote on that. If the motion fails, then we ask for another motion with a reduction. In this case, I think it should be between 14 days, it should be more than 14, but less than 30. But that's only a fallback if we have to use it. So I'll just call the roll. Dr. Reed, yes or no on the 30-day suspension?
No.
Okay, Amy, yes or no?
Yes.
Meg, yes or no?
Yes.
Lorenzo, yes or no?
I had a question before we started
Oh, yeah.
voting, but I'm sorry,
I didn't see your hand go up, sorry.
right? And I didn't want to just cut in. I apologize for
Yeah,
that.
if your vote depends upon an answer to the question, I think we should probably allow you to ask the question.
Yeah.
It does, to those. So the first violation was in 2022. What date was that specifically?
October 6th, 2022.
So 2 years
October
ago.
6th. So if by our regulations that we adopted in 2023, and I'm going through the Plymouth website, it's within a 36-month period, which would bring it to 10/6/2024, right? That period would be over.
Yes.
Yeah,
No,
No,
we
no,
got one more year.
It's 25,
2025. Okay.
yeah, 22 to 23 to 24 to 25.
25. Great.
Yeah.
Thank you for that. It's straightening out my math.
Okay.
Yep. Thank
Now,
you. That was,
would you like to vote yes or no?
yeah, I would like to vote. My vote would be yes.
Okay, my vote also would be yes, so there's 4 in favor of upholding the 30-day suspension, 1 opposed. Please, 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 make sure that you utilize the new technology. We really don't want to have to deal with what happens at a 4th violation.
Thank you.
Thank you. Next item of business. Our friend Blake is here. Ticks and mosquitoes and all kinds of horrible stuff.
Hold up my laptop to that, because I have some slides to show.
You can figure it out. Don't ask me, because I did. Do you want us to hear, Blake?
Maybe.
You are more than welcome to sit.
Yeah, some things to show, I could just talk about it.
Pictures are so much better.
They are, yeah.
Especially if they're nasty.
And I think.
Oh, you don't have any, a good like
Oh,
up close.
are part of the meeting. I could probably just join that meeting and.
Yeah, if you do that, then you can immediately show things from your computer.
That's-
So do I need to do anything?
Apparently
You
not.
need to let him be a presenter, or no, I guess, you know,
As soon as he logs into the meeting, he can show.
So, like, do you want to plug in? or what do you do?
Well, I was gonna plan on, you can sit here.
Okay.
I will join from anywhere.
I know what I'm doing.
Yeah, there's plenty of empty plugs down
Yes. But I think a little better.
So I didn't know if you were coming in person or you were gonna zoom in.
Oh.
If you zoomed in, it would be,
I should
it
have.
would be immediate.
I should have.
No,
I wasn't thinking, I guess I just assumed that. We've done it in person last year and I.
Yeah, they changed our meeting room, so it's totally
Yeah.
different.
So first I need to connect to your internet, just TLP guess, I guess. Does anyone know how to connect?
Yes, so we're at TOP gas.
Yep.
The password is going to be rock with a capital R.
Mhm.
1620. I didn't make it up.
Secret.
And don't tell anybody.
Did that work?
Yes, it did.
Oh.
Alright, great, and it's meeting ID. I think you might have sent it to me, Barry. but-
Yeah, if you got the link, all you gotta do is click on the link on the email.
No, I have the link.
It's in the agenda.
Oh, it's in the agenda.
Yeah, it's down in the bottom of the agenda, or at the top of the agenda.
I wonder if I can.
It's right under the paragraph that says hybrid
Okay, I got it.
participation. Okay?
Got it?
Yep. Yeah. Perfect. Sure.
You should be able to do it now.
Who's the Zoom user?
I think it's us.
It goes.
No, because I'm taking.
Oh, you're not the Zoom
I'm.
user?
No, but just for somebody watching.
We have an unknown visitor. We'll have to try to expand that to full frame.
If you get rid of participants. does
Yeah,
it help
just
with-
click off the participants on the top right.
Click off print.
Oh, there's never been one.
Yeah. Whoa. And I'm not actually seeing participants on my.
Oh, do you have?
Yeah, can you
Can
add
you
out of
click
it?
on I clicked off mine.
Oh, there you go.
Okay. Well, very strange.
Can you shorten that?
Both, yeah. Oh, no.
Um,
Lorenzo.
No offense, Lorenzo, but I hate it here.
You're in the way.
There we go. So that's good.
Oh, perfect. Thank you.
Yeah, excellent. All right, great. So welcome everyone, and I'm gonna talk a little bit about a brief tick update. If you weren't here last year, I'm gonna talk about a few new things, but I will still kind of cover some of the stuff that we did talk about last year. Not a heck of a lot has changed from last year to this year in the tick world, but just a few things. Research is still moving along when it comes to, proper prevention, proper protection. It's going to be, I imagine, a few years before some of that information becomes applicable to your average homeowner. But there are definitely a few diseases that are kind of on my radar that I think would be useful for people in this particular area, not necessarily to be afraid of, but just to kind of be aware of, okay, these things are coming down the pipeline. They are starting to become a little bit more common these days. If they come up, don't panic. This is something expected because they are kind of making their way. So, first bit. Okay, so our ticks bad this year, they're the same every year. If you hear about things being bad, in the newspaper or if you see online, oh, this is gonna be a bad year for ticks. Every year that we live in Massachusetts is going to be a bad year. This is an example of a bunch of ticks that I collected in about 15 minutes walking around a parking lot at Tidmarsh. So just that parking lot in Tidmarsh, that was February, so they're around. I mean, they're just everywhere. This particular time of year where it's relatively dry, been really hot, and your chances of running into a tick incredibly low, very, very low. I don't tell normal people that
Yeah, yeah.
because it's not zero, but it is very low. Once we move into the end of October and things are starting to cool off, these adult ticks will be out in full force. So think around Halloween. Just to talk a little bit about winter survival. As we kind of move into the fall, raking leaves becomes, I would say mandatory, becomes very, very useful for tick bite prevention. This is a study taken, a graph taken from a study, and we can see here is that winter temps got to be about -9 degrees Fahrenheit, 9.5 degrees Fahrenheit. So when we think about temperatures in Massachusetts dropping to about -10, this is not too far off. But underneath the leaves and snow was a difference of almost 40 degrees. So ticks can survive, but they won't survive that if you rake up those. So raking the leaves now as opposed to waiting to the spring, it is very beneficial. And now I know there's been a trend in recent years for leaving the leaves. It's really good for pollinators. It's really good for bees. A lot of bees will nest and they desire those leaves. So when we talk about promoting the health of native organisms, ticks are native organisms. They are supposed to be here. So we do also promote the health of ticks when we leave those leaves. So one thing that I would recommend doing is thinking very consciously about where you leave the leaves. If you have an area with little kids around, rake the leaves in the areas that they play. And if you care about the pollinators, you care about the bees, keep those areas that the kids aren't playing, and you can leave the leaves there as your green mulch or as your mulch in those particular areas. You don't need to rake the leaves everywhere, but focus on the areas that are very heavily used. And just keep in mind that when you leave those leaves, that you are providing little mini tick condos for all the.
A question before you go on, Blake.
Sure.
What about if you mulch the leaves?
It's gonna be less inflative. Unfortunately, I don't think there's been a follow-up study to that particular one showing how much that would insulate the ticks versus ambient air temperature. When you have like oak leaves and maple leaves fall, they do create little pockets there, and the air is what's insulating. You know, if you know how well down insulates when it's wet, not very well. So I would suspect that if you mulch the leaves, you would have much fewer ticks. Probably not zero, but it probably is less, but I don't know what that exact number is.
Yeah, thank you.
So why are ticks a problem? Why, we all know Lyme disease is pretty much, they bite us. It's pretty bad, but Lyme disease is the most important one. We have 10 known diseases here in Massachusetts, and I have these color-coded based on the types of ticks that transmit these diseases. One of the common misconceptions is the dog ticks are okay. Now, I will say that while the dog ticks can transmit 3 different diseases, it is relatively rare. Very, very rare. I do know of a few cases of Rocky Mountain spotted fever in Plymouth County, but it's every few years and it's incredibly uncommon. Usually, the pattern seems to be up and around the Bridgewater and Brockton area, but who knows? Plymouth could be an area. So Lyme disease, definitely the most common. We estimate about 500,000 cases every year, with 95% of those occurring in just 13 states, and that the economic burden of Lyme is about $3,000 per patient per year. So, very serious. While most people do not suffer from what we call a chronic Lyme, it is something we are starting to recognize more and more. And that number, even that 500,000 number, is probably an underestimate of the actual number of Lyme disease cases. Interestingly enough, one of the reasons why our state doesn't have little blue dots is because DPH has been reporting them based on probable cases as well. And you can go on their website, you can see that there are many more probable cases of Lyme than there are actual cases. And the CDC has said, well, that's not the real way you should be reporting Lyme disease cases, so we don't get blue dots on the CDC website. So I think that's babesiosis, general overview. I did talk about this last year. it is a protozoan, it's a eukaryote, it's not a bacteria, which means that there are some medications for treating Lyme disease and other tick-borne diseases that are not really that effective on babesiosis. So understanding that babesiosis is relatively common in this particular area, but not everywhere in Massachusetts, it is something that I think providers should be aware of. And also that, like I said, that it is typically treated with different types. Distribution tends to follow Lyme disease, and we think that it has a lot to do with Borrelia burgdorferi aiding in that transmission of this protozoan. So they kind of go hand in hand. It's kind of facilitating that. So usually you see Lyme disease move into an area, and then that's tend to increase, and then babesiosis following that, and that increasing alongside that. Transmission hasn't been seen, like Lyme disease, hasn't been seen typically in less than 36 hours or less than 24 hours. So daily tick checks, very, very important when it comes to preventing both Lyme and babesiosis, and actually anaplasmosis.
Okay, so another question about that.
Sure.
If we looked at a map of Lyme disease, would we see the same pattern that you just showed us?
If you looked at a map of Lyme disease from maybe like 20 years ago, it might look like this. And then that now Lyme disease is very evenly distributed throughout all of Massachusetts. And so I would say, and I don't have a crystal ball, but in the next few decades, I would not be surprised if babesiosis was also widespread throughout all of Massachusetts as well. That seems to be the pattern, is that you see Lyme disease move into these areas as it starts to spread, kind of migrate out. I don't know if that's the right word for it, because it's moving on its own, but babesiosis, the pattern behind that is that it will follow that kind of same distribution in the same types of areas. Generally, we believe that there are similar hosts and similar ways that the bacteria is spreading around that it shares with Lyme disease. So requiring things like the same types of animals as host reservoirs as Lyme disease, so kind of moving into those areas alongside it.
So the delay has something to do with the number of infectious agents carried by the ticks?
Yes, so we think that maybe possibly Lyme disease may prime an area for the arrival of babesiosis. And so we kind of see, again, the babesiosis Lyme disease moving into these areas, that area becoming endemic for Lyme disease, and the babesiosis being relatively rare in those areas, but due to the presence of the Lyme disease, babesiosis becoming more common in those particular areas. So first Lyme and then babesiosis. Now, anaplasmosis, onychiosis, the one that is transmitted by the deer ticks, that has a different distribution pattern, and we're thinking it might have to do with different hosts, and maybe possibly that the Lyme disease is not as beneficial for the transmission of the anaplasmosis. But we could get all three from a single tick in a given area. They're not mutually exclusive.
Okay, and a lot of people ask us, I get a lot of questions about this.
Sure, yeah.
Alpha gal sensitivity, that scares a lot of people because some of them at least get a sense of extreme sensitivity to beef.
Yes.
I understand why, because I know all about alpha gal.
Yes.
That's not very widespread, is it, compared to the other diseases?
Maybe. I do have a second.
Okay, we'll let you go for that.
I did want to talk a little bit about two viruses that were recently discovered in New York. We used to think that these were mostly distributed in the southern states, heartland virus, we'll see down here, Bergen virus down here. But recently, we found a number of animals that were found seropositive in New York and the Northeast. So it is probably much more widespread than we initially anticipated. They still seem to be relatively rare. We got virus from 60 infections in 2009. Bergen virus, 3. So, but there were both of the 3, 2 of them were fatal. So we think that they're probably around here. There probably are somewhere in Massachusetts. There are currently no treatments for either of these viruses. So it's probably something that just flies under the radar very often, and it's just completely undetected. As far as I know, there hasn't been any surveillance on animals in the state of Massachusetts to detect if these viruses are here. But I could follow up on that and get you some more up-to-date information, but as recently as, I would say, this particular year, there hasn't really been any studies on that yet.
The red states that you showed on that previous slide,
Yep.
those have a much higher incidence of this.
Well, I believe that these are the states, so these represent the states, I believe, where it was supposedly like, we thought that they were like endemic.
Mhm.
And now we're seeing cases kind of crop up from the different states. Actually, it's this case here on Long Island, that kind of that tipped us off to this whole thing, where this man from Long Island had no travel outside of Long Island at all. And so how did he now have Heartland? And we only knew it as a Heartland virus because he sent that tick in to get tested at UMass Amherst. And they were like, it is definitely Heartland virus that you pulled, you are suffering from some sickness. This tick was definitely carrying Heartland virus, and then he came back positive for that. And then they looked at the deer on Long Island, they're like, they have a lot of Heartland virus in the deer on Long Island.
Did he just feel like he was gonna send the ticket, like? I'm always amazed at people that are like, oh, I'm gonna send this in, like.
Yeah, so it's, the tick testing is a very. There's a lot of. I don't know what the right word for it is. We want people to test their ticks,
Mhm.
but we don't want them to bring it to the doctor and say, this is what I have.
Right.
So it's not something that we can really be used for medical diagnoses, because it doesn't mean, like, even if you pull up a tick that's carrying Heartland virus, it does not mean you have it,
Mhm.
right? And we think that's the case with Boston virus. A lot of people may be subjected to Boston virus and just not become symptomatic. Kind of like West Nile virus. And so we think that is particularly what's happening, but the tick testing provides such valuable information about the distribution of these pathogens. And that in itself, I think, is very informative for assessing risk for particular areas. Like I said, like, we would not know Heartland and Bourbon virus were anywhere in the Northeast
Mhm.
without that single guy submitting that tick to get
Mhm.
tested in Massachusetts. So it is beneficial. We wish that we could subsidize it in some ways so that people wouldn't have to.
Oh, so it does cost people to.
Yeah, and I believe that the virus test costs like $100 or something. So it'd have to be someone being like, for the good of humanity, I'm gonna get this tick tested, even though my doctor does not care at all about this. So it's a tricky sell. That's what I'm trying to get at. It's a tough sell because it's something that is beneficial to everyone,
Mhm.
but one person has to foot the bill, and it's not exactly cheap.
There used to be funding for it in Barnstable County.
Yes.
Yeah.
That,
It's
and
not there.
I've tried to get it through Plymouth, in Plymouth. The thing about, it's a difference in the way that the hospitals work, the healthcare system works in Barnstable County versus here. Like, they have Cape Cod Healthcare, and that is pretty much the main hospital healthcare in all of Barnstable County. Which means you can go through one single hospital
Oh.
to get a grant to fund all of them. Now, I've tried to do it through Beth Israel here, I've tried to do it through Southern Medical, I've tried in Norwell, I've tried to do it through, what's in Weymouth,
So sure.
Oh, sure, yeah. I tried to go to all, but they're all disconnected and they have different ideas of what they want. So it's like 3 different grants all line up on the same page. Or I tried going in even our Chenal groups, like Chenal 23 covers most of Plymouth County, but not all Plymouth County. And they, it's tricky to try to align all of these different things, whereas Barnstable County, you work with one grant, with one area, and then that's bing bang boom.
Mhm.
It's been very tricky here,
So
especially
what
a lot of
can
places.
BID Plymouth actually test for in-house?
I don't actually know. I'm not actually sure what they do in-house, or if they send their stuff out to like, Eugenics or something. They must.
Because I have a next door neighbor who got bitten by a tick and started having a lot of miscellaneous symptoms, and he thought he had Lyme disease. And he went to BID and they said, well, this is worse than Lyme, we're not sure what it is. They sent him to South Shore to be diagnosed, and they did a whole stream of tests.
Yeah, like thick panel. they usually call it, Yeah,
And they finally figured out he had babesiosis also,
yes.
so he had both.
Yep, you can get both. You can get, a deer tick can carry probably up to 6 different diseases right here. I listed 5. If Heartland virus is really here, I do believe deer tick.
The most we've seen is 3 so far this year.
But Yeah, you
One
could
tick in 3
hit the
disease.
lottery and get all 6 or all 7 even
Is
7.
it a lottery?
Yeah, it's like snake eyes.
So in October, around Halloween, they're adult ticks, you said, right? They're
Yes.
older, so they
Yes.
carry more disease.
Not necessarily more, it's that their chances of carrying diseases is higher.
Yeah.
So a nymph tick can still carry all of them, but the odds of that happening are lower.
Cause they haven't had time to accumulate them.
Yes, there are some diseases that can be inherited, what we call transovarially, from the mother to the egg. She will lay the eggs and the eggs will carry the infection in them.
Hmm.
And it's very rare. Wasson virus has been shown to do that, and something called relapsing fever, which is Borrelia miyamotoi, that can do that. We think that miyamotoi is actually probably sustained in the environment, probably relies on what we call vertical transmission from the mother to the offspring. We think, because there's not as much, the passage between tick to other ticks is much decreased in miyamotoi. So some of them do that, but those are very, very rare to begin with. And so with the 3 big ones, the Lyme disease, anaplasmosis, babesiosis, those are not passed transovarially, which means that each consecutive feeding of the tick increases the chance of it carrying it. So the larvae haven't fed at all, so they're not carrying either of those 3. And then the nymphs have fed 1 time, so the odds, what we see around here is anywhere from about 20 to 25% of a nymph carrying it. Of Lyme disease, sorry, and then anaplasmosis babesiosis is much lower. I think last time I saw it was around 5 to 10% of each as well. And then that will double for the adults because they now had a second time to feed. So about 40 to 50% carrying Lyme for the adult deer ticks, and then probably something like 10 to 20% for each of the anaplasmosis babesiosis for around this particular area. So it's just the odds. And then these viruses are insanely low. I just want to, again, put it out there that they're here, that they're possibly here, but you could probably test like 1,000 ticks and not find a single one carrying it. Very, very rare. Long-term start tick expansion. What we have here is the historic range, the expanded range, and you can see that it's increasing pretty dramatically. Right here, Bristol County should be red. The red is what we call an established population. So this is different than just finding a tick. Ticks are not very mobile on their own, but they move around very quickly on other animals. And we find ticks that are found pretty much only established in Mexico. We find those as far as Ontario and Canada, just because migratory birds are spreading them around very, very quickly. What we can see here is the shaded regions represent areas where we found just a single tick or a single life stage. Red is where we find the ticks have established a foothold. They're reproducing in that area. They can survive the winters in those areas. The Cape has it in Bristol County. So this was published in 2019, but Bristol should definitely be red. Our county is not red yet, but I do suspect that it's probably red and we just don't. There's probably pockets around here that do have Lone Star tick that has been established. Probably Wareham, if I have to guess, maybe Rochester, the southern portion of our county, maybe even South Plymouth. Bourne, you know, where Plymouth kind of touches Bourne, that was probably red. There, you know, where you get into kind of like the Ellisville area, I would suspect that it's probably around there. This is just kind of give you an example of why Bristol County's red. This was a tick that was pulled off. It was from Dartmouth. Woman had sent me some specimens, identified them as Anglo-American and the Lone Star tick, and you can see that there's multiple life stages here. We've got the larva, we've got the nymph. She did send me some adults as well. So we have the breeding, the life stages going on in Bristol County. Asian longhorn tick, this is a new tick, moving around very rapidly. It's a very prolific tick. This is a single blade of grass, and there's all those ticks. It's only females. They don't need males to reproduce. They just all do it on their own. And so it means that any tick that gets moved into a new area is a new population, because she doesn't need to find anyone, she just lays the eggs on her own. So since its discovery in Huntington County, New Jersey, this has been moving around like crazy. We do, I believe, you can see it all over the ear of the sheep. So this is what I pull this every so often, and this is updated constantly. We can see right now, it does have an established foothold on the Cape. This is new this year. So last year it was not there. Last year, I believe 2 years ago, it was not in Massachusetts. So it's probably gonna be in Plymouth. If it's not here this year, I assume the next year or the next 2 years, you will see longhorn. The good thing about this is that it has not yet been associated with any human diseases. If you look it up online, they'll say it can transmit diseases in its native range, but you need that disease to also come with it, and it didn't. There is some suspicion that it could probably transmit the Heartland and Bourbon virus, maybe, but those are also relatively rare, so the odds of all these things lining up. Relatively uncommon. It does affect cattle, we believe, so anyone that is a farmer in this area should pay attention. It likes these medium, mid-sized mammals, so dogs, it does like sheep, it likes raccoons. It doesn't really like people. You could lay down in a field with all these ticks and come up with not a single one on you. But if you were to walk a dog through an area, so if you hear reports of people like walking dogs in a dog park or things like that, loaded with ticks, something to keep an eye out could be this longhorn tick. Yeah, you can see this is Massachusetts, so probably gonna be here, moving. What else is on the menu? What are these things that I would want to update you on, new kind of things that I've been thinking about in 2024? Boston virus, confirmed and Sharon, it is not a new virus. It's just something that it does seem to come up every now and then. It's still relatively rare. We do think that there are, I don't even know if I have data on whether or not it's becoming more common. It's just, we think that there's a number of people that are probably subjected to this virus and just feel nothing, that are just asymptomatic to it. Because there are many, many more ticks that come back positive for it. And it doesn't line up with the number of people that become sick from it. So we think that kind of like another strike against the tick testing, you could get a tick coming back with positive virus, doesn't mean that you're gonna die. Because I think that this doesn't put a 10% fatality rate with people who do become symptomatic for it. So it can be very scary for those particular people.
Is there an age distribution where the older people are much more likely to be more severely ill?
Don't know, actually. Or I did know at some point, and I just am getting things done. I don't actually know. With the other viruses, Heartland, now you just reminded me, with Heartland and Bourbon, it is kind of like an immune age-related component where people are getting sick from those. So that is with those. I think it is with this, but I don't want to say yes for certain because I don't know. I think I remember reading that, but I think I might be getting it jumbled up. Because one of the few that is not age-related is Lyme. Lyme seems to hit all age groups pretty evenly. But the age distribution is mostly associated with people who spend time outdoors. So kids age 5 to 9 and then senior citizens. So they're doing a lot of stuff at the time. And the people who are working, like we are right now, inside indoors, have like kind of lower rates of Lyme disease.
So can I say something about Powassan? So I do the Maven surveillance for Barnstable
Okay.
County and Nantucket. And I can tell you in the last 10 years, in Barnstable County, we've had 11 cases of Powassan and 6 have passed away
Wow.
due to their infection. And we've had 2 in the last couple of months, 1 in May and 1 in July.
Yeah. Wow.
And so I started to say this last time, the state grabs these cases immediately. They don't notify local boards of health. So you have to run a report to uncover these things. We're trying to change that, but as it stands right now, they don't alert us
Wow.
to these cases.
Interesting.
Yeah,
They should be notifying local departments and public health. That's
They should. Yeah.
wrong.
They do the investigation on their own and it's pretty extensive. It's kind of a long-term investigation.
Yep. But thank you for that.
Yeah.
Makes me wonder if it is becoming more common. What is interesting about this Powassan virus is that there's 2 lineages. And so it might be associated, like we have what we call lineage 2, which is also called deer tick virus. And so that one, so the lineage 1 we believe cycles in woodchucks, which we do have around here. and then the lineage 2 cycles in deer. So we think that it's possible that maybe with the abundance of deer, and kind of this resurgence and how common they are, that it's possible that maybe that's leading to an increase in those fires. Maybe that's why you're seeing those cases on the Cape kind of spike up, or where there's so many. I don't know. It's just maybe something for a graduate student to explore. Very cool. Not cool, that
Yeah.
interesting. Alpha-gal syndrome, we're calling this a syndrome, we're not really calling it an allergy because it's an accumulation of all these different symptoms. This kind of weird situation. They call it like the allergy to red meat. There's a few things that are kind of misleading about this particular condition, and I do want to cover some of those. So this alpha-gal syndrome, or this allergy to red meat, right? It can take two different forms. One is like an immediate reaction where people will get an immediate response to this red meat, and that's not the one that we're talking about. That's not the one that's associated with these ticks. Or the one that we're talking about that's associated with tick bites is a delayed reaction, where people will ingest something like burger or like steak, and 6 to 8 hours later, then then kind of maybe get hives, they might become anaphylactic, or it could become just maybe itchy. All these different things can crop up. So there's these two different reactions, two different forms. It's based on an oligosaccharide, so it's not actually a protein. It's this really unique molecule that is only really found it's not found in humans or apes or old world monkeys, but it's found in virtually all other mammals. And it has to do with the fact that when humans evolved, there was a deletion and we just kind of lost that molecule. We don't produce that anymore, but we still produce antibodies to this particular molecule. And so what we find is that, like, for instance, like when you transplant like a pig organ into a body, one of the reasons why we reject it so readily is the alpha-gal oligosaccharide that we have the antibodies for, and that's why we kind of push it up. So we're already kind of predisposed to want to develop these antibodies to this particular thing. What is interesting about this is that there are many things that we consume on a daily basis or are exposed to on a daily basis that do have the alpha-gal in them, like the red meat, gelatin, vaccines can have it, certain types of drugs that are grown, maybe like mammal cell lines, and even like the capsules, like the gel capsules, they can have it as well. So people could be reacting to these as well. What is really interesting about this is that what I think is kind of confusing a few people is that we still don't know what is, or even if it is associated with it. Here's what we have, right? We have in the United States and Europe, this correlation of people who are having alpha-gal, and then they also talk about having been bit by a tick at the same time. It's just a correlation. What we have in terms of data is that when you test a tick, what you'll find is alpha-gal in that tick. How it got there, we're not really sure. So we have this kind of like thought that it could be from this tick that maybe is biting these people. We don't know if the alpha-gal is from a previous meal or from something that is just in the tick saliva. We're not actually sure. There was one actual study that was run where they showed that ticks that had never fed at all were actually triggering alpha-gal in mice that had been basically genetically modified to not express that alpha-gal, so they could become. So you could actually sensitize an animal on a tick that has never fed anything, which is interesting because we used to think it was maybe a previous blood meal or something like that. We're not actually sure. What is also really interesting is that this correlation between tick bites and alpha-gal is only really happening in the United States and Europe, but in other locations around the world where they have reports of alpha-gal, these people have not expressed that they've been bit by a tick or anything like that at all. And single tick bites are not what's triggering it either. It seems to be multiple tick bites. So it is this really interesting thing. It's probably this confluence of different things happening at the same time. Also, you know, it's only been discovered in the past decade or so, maybe 2 decades at this point. But we've had red meat in this country forever, since like the 1600s or whatever. So like this is a new thing coming up. in a new time, and all the correlations don't seem to be consistent across geographic locations, so. Expect to hear more about the causes of these things, and if you're going to be talking about these things, I think it's important to kind of just express that like trepidation about. This is not definitely caused by a tick, it's not definitely going to be this. If you get bit by a tick, you won't definitely have this. This is just what we know, so that's kind of what I want to put out there. It does seem to be becoming increasingly more common. Like if you look at this line down here, there was a study conducted over 5 years, they looked at, 350,000 people, 90,000 of them were positive for this antigen, right? So that's a very, very large proportion of the people that were part of this study. About 30%, I believe that they pinned it as. So it's possible that maybe all of us are positive at some level, like anyone who's had a tick bite might be positive at some level, and just, oh, I had a piece of meat, but you don't get anaphylaxis, you might just get indigestion, or a stomach ache, or even you drink milk, maybe you might think, oh, I'm lactose intolerant, but in reality, you might be having a sudden reaction to this. So we don't actually know, and then when you go in to get this tested, the only thing that we can say is that you are expressing the IgE antibodies to the alpha-gal, and that's it. They don't know what caused it, they don't know it's there, they're not sure. So all these things, a lot of mystery surrounding this. But yeah, and you can see like this is kind of the distribution of where people were kind of becoming basically what we suspect are people who suffer from alcohol. You can see most in this kind of bar. So it's mostly been associated with the tick, but so far we've seen that pretty much all of the ticks, a large proportion of these ticks have been kind of have that alpha-gal, and then we're coming back positive for it. You can test them, and then in Japan and China, they don't really have the Lone Star tick, and yet people are still getting alpha-gal. So they're probably getting it from what we think maybe the longhorn tick, actually, the one that is moving up into our area. But it's kind of weird.
Can I say something?
Yep.
I'm sorry, or should I wait till the end?
No, you can say something.
So alpha-gal syndrome is not reportable, so we're not gonna
It's
see.
not.
Yeah.
No.
And I just got these numbers recently from our epidemiologist in Barnstable County, but she also covers Nantucket and Martha's Vineyard. And she said there's 250 reported cases of alpha-gal on the Vineyard and Nantucket alone. Just those two islands.
Yeah.
They even have like support groups set up for it.
So they've gone to the hospital, they're like, all right, you have this.
Yeah,
Like, they're not just like, oh, I think I have it, like
it's confirmed.
wow.
But about the symptoms too, like it's not always consistent, I guess.
It's not.
Yeah.
No. There are certain things that tend to trigger it more than others. We're finding it's like fattier, like heavier, like if you could have like steak tips can be fine, and then you feel like prime rib, then like you're not fine. And so like it's not consistent
Right.
at all. Like it's and like that's the other, like the test, even the test for it, like they said they just look for the IgE antibodies against alpha-gal, and that's it. They don't know, like it could have been from anything, anywhere. And that's all they're kind of looking for. And so it's just a kind of weird situation where, again, there's a lot of people who are certain, like, oh, I must have gotten it from this tick. But there's so much in reality, there's so much inconsistency in the data and so much mystery around it that we're not. Well, all we know is it seems to be becoming increasingly more common, and there are more people suffering from this than we realize. Kind of all we know.
Yeah, it's complicated because apparently alpha-gal is also found in gelatin and gelatin capsules,
Yes,
and almost everybody ingests them.
yes, yeah. But that's not necessarily fatty. So like that's the other thing. Like you could do gel capsules fine. You could do like low fat milk fine. But then maybe you just don't do like pork fine or ice cream or something fattier. And so we think it has to do with like why it's delayed is that when you start to digest it, when it gets into your intestines and when it starts to get absorbed into your blood, like that's what we think is that kind of like transition where it's starting to go into there. And we think that that's part of why it's this delayed reaction and why the fattier materials seem to do it more. But again, that's just kind of speculation at this point. We're not really sure why.
I'm curious, why is it not reported, and yet we have statistics, I mean, even Devon
Yeah,
has
so
found numbers from cirrhosis and other things that are apparently not reported.
That's reported.
That is.
That is,
Bobby,
but others are not.
so Alpha Gal's not, and I think we have to like go to the state and request that it become reportable, is my understanding.
When
This is new to me.
I talked to Larry, so Larry retired from the Cape, and we used to have this relationship with Katie Brown at DPH. And Larry was very set on getting Alpha Gal reported. And I think there was some pushback, at least at that time, with DPH about not being like, oh, that's a good idea, but X, Y, and Z. And so it was not, but, I think that's bad. It was, oh, like, we'll see, like, check back in the next few years. It was something along those lines where I think that with the numbers that you have, you could
Yeah.
probably make a better case. And
Yeah.
like Larry was just kind of, I think that this is a good idea. Let's do this, have some more work. But now that we see this becoming more common, it's probably a good time, like, to maybe bring that up again.
Because the DPH.
But it hasn't.
DPH gets all the data.
They know.
I'm sure they know.
Yeah, they know. And
They
it's
have the
been-
data. They
like,
just don't want to use
They also do, this big major conferences in Barnstable County. And, Katie Brown, she's on this board, like, we're part of this tick task force. And, she's on there, so she hears about all of this stuff. She knows it's around. So she's aware of it. Again, probably pushing that, probably a good idea.
it.
As much as I like Katie, I don't want to do more work, but, just an idea.
I wanna know how many, I wanna know
Yeah.
how many.
I like data too. I like seeing data. I like. We're in some trends. Something that I think I see circulate on social media a lot, certain different things that maybe would be useful for if you have questions, things to address. I think the first one that comes up are these organic, all natural sprays. At this particular time where you're talking about the mosquitoes, that they were pretty bad with Triple-E. I see all the trucks driving around. Yard sprays for mosquitoes and ticks are kind of like this wild west, right? It's one of the few things you can do where you pay someone money up to 150, maybe even more dollars. And you don't even double check the work. You just hand the money over and you say, thank you. You've maybe assuaged my fears, but maybe not even done anything, right? And when it comes to these all natural organic yard sprays, the data on them is really sketchy at best. What you can see here, this was a study done in 2016. So it's a little bit old at this point, but this woman looked at a bunch of different all natural treatments. And the bars being high are the number of ticks that were collected. So a high bar is not good. And the bar being low means there were fewer ticks collected. So you can see this is kind of like your synthetic gold standard pesticide. When they go and they do a tick spray, easy bifenthrin, 0 ticks. These all natural, no significant difference. Essentially, IC3 is the most common of these all natural pesticide sprays. And you can see that's the same as water, right? And the left bar is knockdown. The gray bar is the residual. So how many ticks were found immediately after the spray, and then how many were found like 2 weeks after? You can see that maybe a slight knockdown, but it wasn't even statistically significant. And then the gray bar, no residual. And so they looked at all these cedar side, 52, the center here had some knockdown here, but didn't have any residual effect on tick stop, tick kills. Again, center has some knockdown, but no residual activity. So you can see that people are kind of throwing their money away when it comes to these essential oil sprays, and they think that they're doing better, but they're really not. And so when it comes to public health, when it comes to protecting health and preventing disease, my recommendation is that if you want something better for the environment, you just don't do a spray at all. Just do nothing, because then you can save your money, and then instead of spending on a spray that won't do anything, right? Or if you want to do the yard spray, that you just go full out and you do something that has been tested and does cause those significant reductions in the number of ticks. Something that you would be able to rely on, not something that is just kind of gets single. Another thing that worries some trends are the counterfeit products from online retailers. We saw this kind of peak in 2020 during COVID, but people buying stuff like dog collars, pet medication. This was the collar was purchased with Amazon, and this was the collar that the vet's office had. and the packaging looks the same. In this particular example, the vet came in, it was almost dead. Sorry, the dog came in and was almost dead. The vet took the collar off, it had burns all over its neck. And a lot of people are complaining, they don't want to use the source of colors. And we saw a spike in the reports on these dogs suffering from source of color right around the time of COVID, right when kind of online shopping. So correlation, yeah, but probably a lot of people are now getting their pet meds through places like Amazon. It's not surprising that you're seeing a spike in the number of counterfeit products that come through down the pipeline. So my recommendation, go to your vets. You can probably go to Petco, go to PetSmart. So if you do have recommendations, if you do have people coming to you, what should I do? What should I do for my pet? I always recommend just go through your vet. Go to Petco, go to PetSmart. I think Chewy is probably okay as well, but not Amazon, not even Walmart.com, not Target.com, not any of these other non-vet trusted sites. So those are my worrisome trends from just some things I see online. Because people will say, I don't want to use the collar. And if you don't use the collar, the risk, I think, is way worse. Heartworm and, heartworm, Lyme disease, all these different diseases in dogs bringing things in when you're just sitting in your pajamas, all these things are way worse than just getting the pet collar through a trust. So, and I think we should focus on science-based protection and education. There's really no substitute to this, wearing repellents, permeating on your clothes, tick checks at the end of the day, very, very important. What to look for in repellents, deep Picarin, IR3435. I don't have another repellent here that's recommended by the CDC. It's called oil eucalyptus. The reason why is that while it has been shown in some studies to work on mosquitoes, the studies on ticks are incredibly sketchy. Like they're just not very good on ticks. One was showing amblyoma on Lone Star tick, where the tick would not be deterred from climbing on someone, but just take longer to bite. So that's not something that you really want to use. And then another one, it showed some repellency on deer ticks, but those were in like petri dishes in a lab, but there has not been a study on those, on whether or not they affect people and the environment. So not something I highly recommend. I recommend just use the three of those. Permethrin, I think we all know what this is, very, very important. Tick checks. I think diagrams are not very helpful when it comes to tick checks, because there's not a spot on your body that it can't bite. And those diagrams, I don't know if you got a good look at them, they're all different. Like some of them are like check armpits, and the other one doesn't say that. And the one's like check behind your head, and the other one doesn't say it. So you're like, well, which one do I follow? Your whole entire body, it's not gonna save you any time to just not check your armpits while you're checking your head and your lower back. And then last but not least, with the right knowledge and awareness, tick-borne diseases are. We've been asking questions through, but if anyone has any lingering questions at this point about anything that I covered, please feel free to let me know.
No, this is great. Thank you.
Lorenzo, we can't see you, so if you have a question, you can certainly ask.
I hear no one.
Do you have any information on like vaccines for tick disease? I don't,
On people,
yeah.
Okay. Yes. Question mark. Every now and then it becomes one of these things that these pharmaceutical companies think that they want to do, and then almost without fail, it never happens. But the last attempt, I believe, was through company in, what company was it? It was I believe it was in Europe. It was a company that was trying to push this vaccine, and it made it all this way up to like phase 3 clinical trials. And then they had done something that was like non-scientific or something weird, and they decided it would be too expensive to repeat the study, and they decided just to can it and not go forward. So a lot of times these things come up. The old Limerix that was kind of released back in the 90s, Telford from Tufts, he's been wanting to bring that back, because instead of developing a new vaccine, you can just get that, you could just run battery tests on that, which would be way cheaper, and put that back on the market. But no pharmaceutical company wants to touch that because they're afraid of the lawsuits that might come through. In general, companies are held to this very high standard with all vaccines. I don't want to be kind of mansplaining into you, but with all kind of these pharmaceutical companies are balancing like, what are the odds that I'm going to get sued? What are the odds that someone's gonna purchase it? Is it gonna be covered by insurance? How many people is it gonna affect? Like, are people gonna do it? And so I think that vaccines could be incredibly helpful, in my personal opinion, at preventing certain diseases. I mean, there are some people looking at not just a vaccine against Lyme, but one that might be a vaccine against just tick saliva. So that you could get bit, if you were bit by a tick, then you would react to a tick. And so it wouldn't be this check yourself every 24 hours. You'd be reacting in like 15 minutes and could get that off. And I think that the last bit of research that I found, they did, I could get you the name of the guy, but he published some work on it. And he did find that he was successful at finding the proteins. It's like actually a slew of proteins, not just one, that you can use like an mRNA vaccine and just basically get someone to become, he was using it in animals, the animals were becoming sensitized to the tick saliva. So it is possible. I think that's kind of maybe the future of it.
That's interesting.
And it was very
Yeah,
interesting.
I do think, like, I think when I get bit by a tick, I do think I feel it almost immediately, but maybe those are the ones I find. You know, like, I don't, like, I don't know if.
Ticks are very good at, so when they bite, they inject a lot of things, immunosuppressive agents,
Yeah.
all these things, but they don't inject it just once, they modulate it. So when your body is responding, they will do a little bit more and then they kind of bounce. It's this constant game that they're playing with our immune systems where they're trying to balance things out, right? And so they're not just, you see them and they're just sitting there like this, but like they're actually doing a lot of stuff while they're attached. And the ones that you tend to find, it's probably, in my experience, it's one of two scenarios. The tick messed up due to genetic differences, and your
Okay.
body just kind of reacted.
Yep.
It was like, oh, I found you, I got you.
Yeah,
And then the next reaction, the next one is that you've been bit so many times that you've built up this immunity to this immune response to the tick saliva
Yeah.
already.
yeah,
And that you're able to, when the tick just starts to attach, it does its first spit, your body's like, I've been there before.
yeah.
And they know that it already knows. So it's
That's
one of those
interesting.
two things.
Yeah, yeah, and like I said, I mean, I think I get them right away, like I feel something, you know, I can be asleep and be like, what? And then find out, but that might be just the ones I find, like I don't know.
Yeah, it's possible. And that's brought up a lot. Like one of in the study that I read about the alpha-gal, they put that out there that possibly in China and Japan, where people were not seeing that correlation with alpha-gal and tick bites, that maybe people just don't know in those countries, like maybe their level of education and tick awareness has not caught up to where it is in the US.
Yeah.
Because like they don't have really a lot of Lyme disease. Like Lyme disease is the biggest in North America and Europe, right? And they do have it in parts of Asia, but it's not nearly as big there. So it's possible their awareness and their outreach is just not up there.
Mhm.
And I do suspect that.
Yeah.
As well. Because there are probably a lot of ticks that, I think there was a study that I read at a children's hospital, they found, this woman, found that 81% of children with Lyme disease never remember being bit. So
Yeah.
they're-
Yeah,
yeah.
that makes sense.
One
They
thing,
probably see ticks on them, but-
one thing you didn't mention, how long does it take for a tick once it gets on you before it actually attaches?
It can take a long time, sometimes hours. So a tick could be on your leg for 2 to 4 hours, maybe even longer, and just not bite you, and just crawl around. And I know it sounds weird, crazy, I know, I love scaring people. But, yeah, so they take their time with a lot of things. They will, you know, even when they're crawling, they'll try to dodge around body hair and things like that. They're just, it's like, well, I think it's all slow and steady wins the race. Because they only need to eat 3 times in their 2-year lifespan. So they need to be very careful of biting in the right spot before you find them. They like to bite in places of our body that are hard to reach, hard to see. They will, even on animals, you'll find is certain ticks will bite only like the rear end of an animal because they've learned, they just,
It's hard to get it.
yeah,
a bit
it's hard to get
animal
straight up, yeah.
Mhm.
Yeah, because a lot of people say just, you know, if you're gonna be outside, when you come back in after you do a tick check, make sure you also shower.
Yeah,
Yeah, I don't do that, me personally, I don't do that all the time, I just make sure that I do one tick check every single day. Doesn't always coincide with the shower, but usually it does, but it's not always as soon as I get in, it could just be, oh, it's 11 o'clock at night, I'm gonna lay down for bed, just quick 15-second, check myself and hop into bed. Maybe that's something you wanna do, is
Yeah.
think about ticks before
I
you get in
could,
bed.
I could go to sleep if I just tucked into bed.
For me, it's become kind of the opposite, where now I think like, I need to do this or I won't be able to sleep.
Right,
So I think I'm the other way around, where now it's that peace of mind that I get from doing it and going to sleep.
Why is Nantucket such a hot spot for all these tick diseases?
Ticks tend to be associated with, coastal, kind of warmer areas. And the ecology of certain areas plays a huge role. The deer are kind of implicated as this like host that ticks really care about. And that is true, but it's not just the deer. They have this really interesting ecology where they feed on different animals at different stages of their life. So when they're really small, the deer ticks that are active right now tend to be feeding mostly on these small rodents. So chipmunks, shrews, and voles are really, like, some of them are really, you might not think you have like shrews and voles, but you probably do. They're very cryptic, very hard to find, and they kind of scurry around in the leaf litter. You can take a larval tick and put it on a human, and it probably will not bite you. But they tend to really want these small animals. And then when they get to the nipple stage, they kind of move up. It's like they still will bite mice, but they'll also bite like dogs and humans and things like that. And then when they're adults, it's really hard to get an adult tick to feed on something that is smaller than a human. You can put them on mice, you can put them on like chipmunks and stuff, but they won't really want to bite. They like the blood of these large animals. So it's really hard to get them to kind of rear them on mice alone. And so this dynamic that they have, and to kind of go answer your question, the dynamic they have on Martha's Vineyard and Nantucket is they've got these nice coastal environments, and they've got this right balance of these forest communities where they have deer, but like when you start to develop land, what you tend to notice is that animals that control, so when we're talking about those animals, the deer, the chipmunk shrews, the mice, things that control those and keep those populations in check tend to drop out when you start to develop land. So bears, like everyone's like, oh, well, it's so weird, we saw a bear, but bears are like kind of supposed to be around. We just have developed and fragmented areas so that they're rare now. Hawks, owls, foxes, bobcats. I've never seen a bobcat here in Plymouth, but they're supposed to be here. And they do a large number on those small rodents. So a lot of these animals that would keep these animals in check, they drop out when you fragment certain habitats. So when you look at Nantucket and Martha's Vineyard, you'll see is like suburban, kind of a lot of developed land, and then it's coastal. So all that like area, like if you think about like White Horse Beach and like that kind of area, that's like prime, like tick, like it's developed, it's right near the coast, like all these areas, like it's like perfect, it's like right. So like, so that's like what you see, and like even when you move further inland, like you don't see like the Bridgewaters have lower rates of crime typically than Norwell, Hingham, Plymouth, Wareham, Rochester, like they just tend to have that, and then the developed lands tend to have more of it too, until you develop so much of it that it's like Brockton or Hull, then you have no line again, it kind of drops down.
We gotta move on, but any quick questions?
Yep.
Lorenzo, any quick questions before we move on? Thanks an awful lot, Nick. We learn so much every time you come and visit.
In case you didn't realize, I can talk about ticks like
Yeah, well,
forever.
I could talk about cell service carbohydrates forever because that's what I worked on in my research.
The kind of thing that you spend so much time doing that you just are excited to share.
Yeah, it's hard to control yourself when you've been working on something that's so long.
Yeah.
So, thanks a lot. I
Yeah,
guess we'll see you
absolutely. If
again.
anyone ever has questions about anything, just, that's what I'm here for, is just reach out. I feel like I get, an email once a year from Barry and then that's it. But if you guys ever have like, just let me know.
Okay.
Thanks,
everybody.
Thank you.
Happy chick hunting.
Thank you.
So next thing is real quick, I sent everybody a copy of the Board of Health meeting conducting procedures. All I did to it was I removed the statement, that was objectionable from a legal standpoint. And if no one has any objections to it or doesn't want to discuss it, we'll just take a vote on it.
Okay, I'll make a motion to accept it as policy for the amended copy as Board of Health policy.
All right, is there a second? Just take a roll call vote real fast. Dr. Reed, yes or no? Amy, yes or no?
Yeah.
Lorenzo, yes or no?
Yes,
Meg, yes or no?
Yeah.
Myself, yes. So you can mark it as approved unanimously on today's date. And I think we're done. It's also going to our Public Health Excellence Grant Group,
Great.
because I think they need it even more than we do. Just an extra. Director's report, can you do that very quickly?
Sure. So just a couple of things to point out, talking about mosquitoes. We have had additional IEEE positive samples. So it's still important to remember to know what your risk is and to repair your screens of your house. Beware of stagnant water. Wear long sleeves, long pants from dusk to dawn. Use mosquito netting if you're walking any babies. And then also Plymouth will continue with, the town-owned parks, fields, and beaches will continue to be closed from dusk to dawn. I thought this was kind of interesting. There was a little article called "Can Your Reusable Water Bottle Make You Sick?" So it's, just a little article that talks about, yes, it absolutely can. So all of our reusable things that we all carry around with us, we have to remember that it's really important, that we clean them, because they can certainly transmit bacteria and it can make us sick.
The bacterial content of those things is off the scale.
I can only imagine.
So what they recommend to do is to make sure you take the time to clean all those hard to reach places. Water bottles have nooks, crannies, and removable parts. All those areas can harbor bacteria and mold if not cleaned properly. That's why it's important to remove all the pieces and wash them thoroughly. Even use something like a wire brush. So whether it's stainless steel, glass, or plastic, they all need to be regularly washed to avoid the buildup of bacteria and mold. Just our public health nurse cases for August, we had 31 Lyme, only 1 flu. And October cases, I had already given you June, July, but I only gave you half of August last time we met. So the total number of COVID cases for August was 136. And then we do have 3 ponds that have active cyanobacteria advisories. Just a reminder for folks that per state protocol, a minimum of 2 weeks of no visual bloom has to be present in order to lift any of the advisories.
Which
So,
3 ponds is it now?
Clear Pond was effective June 24th. Big West Pond was effective August 28th, and Little West Pond was effective 9/3.
Karen, when it says a 2-week period, do you go out after 2 weeks or do you have to look at it every day?
No, we have people that go out and look at it, and also we actually have a very active group of residents who send photos.
Okay.
You know what I mean?
Yep.
So that takes care of that, and that's it.
Yeah, thanks, Cal.
Thank you.
Just a couple of real quick things before we call it a night. Wanted to mention that I saw this online. Teenage social media use. They did a study, it was a fairly extensive study. They found that among teens that spend 3 or more hours per day on social media, their risk of depression doubles. And most teens nowadays are spending about 5 hours a day on social media. So just so you're aware. I was gonna ask if the board wanted to issue a vote to support Plymouth's closure of the parks, fields, the parks and fields from sunrise to sunset. If you wanna do that, if someone would make a motion, we'll do it real
I'll make
fast.
a motion.
It's dusk to dawn.
That's
Yeah.
fine.
Yeah.
That's the-
Karen, I have a quick question.
Yeah.
Is there, was that issued by the department or by the state?
This was issued by our town administration.
By the town administration? And is it until a certain time or is it standing until?
It's standing until further notice, but we are meeting every 2 weeks with Katie Brown, Dr. Brown, and Sam Wong.
Mhm.
To talk about, has there been any change?
Mhm.
But as of right now, all the data that we can look at, we're keeping it the way that it is.
Mhm. Mhm.
Yeah, there has been pushback from some of the parents of
Mhm.
school football
Mhm.
players, as you can imagine.
Well, I'll make a motion to support the decision.
Okay, is there a second? No, I'll just call the roll again. So it's a motion to support the town administration's decision to temporarily at least close off the parks, the public parks and fields, from dawn to dusk. Right?
Dusk to
Just
dusk.
Dusk to dawn. Yeah.
Then you really get the parents. all-
I know.
I got mixed up there. So just take the roll real fast. Dr. Reed?
Yes.
Amy?
Yep.
Lorenzo?
Yes.
Meg?
Yes.
Myself, yes, it's unanimous. Not that I thought it would be. Anything else anyone wishes to bring up?
No, thank you. This was great. Thank you.
What about the next meeting? Are we gonna
Oh,
keep on
The next meeting, I think the second, it would have to be the third Wednesday in October, is like the 16th.
Is it? Yes.
I think it's the 16th.
Yeah.
So I would recommend that. Our option would be to have another meeting very early in October, which would be only like maybe a week or two beyond this one.
So I'm sorry, so you're saying it would be
The
October
October
16th?
16th, I think is that Wednesday.
Alright.
Just a heads up because of,
Yep.
then November has a holiday towards the end. So for November, it might be wise to use the meeting date as the earlier date,
Mhm.
so we don't run into anybody traveling for the holiday. I would think that would be wise. So it's the next meeting will be the 16th from 5 to 7. And we'll see what we can find to amuse ourselves with that. So we just need a motion to adjourn.
So moved.
Second, please. And Dr. Reed seconded the motion. No discussion. Dr. Reed, yes or no? Amy, yes or no?
Yep.
Lorenzo, yes or no?
Yes.
Meg, yes or no?
Yes.
Myself, yes. It's unanimous. The meeting is adjourned.
Thank
Have a
you.
good night.